National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at nationalnutrition.ca. Today I want to tell you a little bit about sleep apnea, as it's a very, very common concern and the number of people getting diagnosed seems to be growing. So what sleep apnea is it actually translates as lack of breath when you're sleeping. Now there's a couple different reasons you can have this. The two main sort of causes or types of sleep apnea are obstructive sleep apnea, where essentially the muscles in your airways relax too much, and essentially what they do is they collapse, close down, blocking your breath, and that of course means lack of oxygen to your brain, which is of course a very detrimental thing to have. The other type is a different type, which is what they call central sleep apnea, and it's actually a nervous system disorder where your nervous system doesn't regulate oxygen and CO2 levels adequately, and it doesn't adjust your breathing as quickly as it needs to. Again, same kind of idea is happening. Your body's not actually breathing adequately for your needs during sleep. And sleep apnea, it's quite a common condition, and with heightened awareness, I think we're seeing more and more diagnoses. Typically, the person suffering often doesn't realize they have it. They'll often complain of things like waking fatigued, waking as if they didn't have a good night's sleep. Many people won't realize that they're waking up repeatedly throughout the night because of the apnea. They just think that they're waking up and have difficulty sleeping. So different types of what we would call maintenance insomnia or fatigue on waking up might be signs that you have sleep apnea. Otherwise, typically people discover they have sleep apnea because of their partner or a family member that complains about either their snoring or they notice that the person stops breathing in the middle of the night. The best way to diagnose it is to go for a sleep study where they can actually monitor things like your oxygen and CO2 levels, as well as monitor your breathing. That way they can tell you if you have sleep apnea, and then if you do have it, what type of sleep apnea it likely is, whether it's that obstructive or whether it's that central sleep apnea, because treatments will be a little bit different. If it's more the obstructive type, usually management of the condition is done through what they call a CPAP. What it basically is it's a breathing apparatus that provides constant pressure and basically forces the airways open when they relax too much. The thing is, it's just a management tool. It's not actually curative. So what you want to look at is the reasons why you have the obstructive sleep apnea. It's heavily associated with smoking, alcohol use, and being overweight, as well as certain medications like muscle relaxants and some anti-inflammatories. And so consider looking at and reevaluating your use of some of those substances if you do suffer from sleep apnea, because that could actually be the cure you're looking for. As well too, if you're overweight, typically losing weight and getting yourself back to a healthy weight is an easy way to help overcome that sleep apnea, and often again that can actually cure the condition. So looking at, instead of having to use a CPAP for the rest of your life, getting at the cause of why you have the apnea in the first place, as opposed to constantly having to use a CPAP and readjust a CPAP for your changing needs. So if you do suffer from sleep apnea, consider looking into some of those mechanisms behind it. Some of the things you can do supportively in addition to that, well, improper adrenal function is actually associated with sleep apnea. That might be part of why the body's not responding to the changes in oxygenation as appropriately. Part of that is actually regulated by the adrenal gland. So oftentimes supplementing with certain herbs such as Rhodiola and Ashwagandha, which can support the adrenal gland and normalize its responses, that can sometimes be helpful in apnea patients, as well as ruling out calcium and magnesium deficiencies. Sometimes these minerals, which actually govern relaxation and tightening of tissue, they can actually be involved in the progression of sleep apnea. So again, making sure you don't have a calcium or magnesium deficiency can be helpful in understanding your sleep apnea. So if you do suffer from sleep apnea, I hope this video is helpful. Any questions or comments, you can post them below. Remember, you can always subscribe to our YouTube channel so you can get more of these videos when you want them. And always remember, last but not least, knowledge is health.